Good evening and welcome to Iowa News and Views. My name's Joe Balcom. I'm the host of the program. I'm also a county supervisor over here in Johnson County, and that's what I do during the day and produce this show every couple weeks. This is, I believe, show number 20. Is that where we're at? Show number 20. We've been producing a show since February. We're producing a show on community and state issues of importance to Iowans, and we're interested in your ideas about what you think some of those issues are and some possible guests for the show. We'll be giving an email address on how to contact us, as well as some other information on how to contact us. Please send us your ideas. We'd also like to thank the Iowa chapter of the Sierra Club. Iowa News and Views was recently awarded the 1997 Iowa Environmental Journalism Award for a series of shows that we've done over the course of the last year on environmental issues of interest to Iowa, and we appreciate that acknowledgement by the Sierra Club and appreciate that award. So, as we've said before, you're not going to see some of the topics anywhere else that we cover on this show, and we encourage you to keep tuning in and checking us out. We've got a very interesting show tonight. We're going to hear from Clara Oleson on the People's Podium later, talking about the Iowa Civil Rights Code. But before we do, the topic tonight is talking about taking care of our children, and specifically we're interested in talking about how we're addressing the health care needs of young people in our state. And we're very pleased to have with us Foege, state representative. He's a Democrat from Mount Vernon, House District 50, which serves southern Lynn County and northern Johnson County. Ro, thanks for being with us.
Thank you for having me here, Joe.
Ro is with us tonight because of the work he's been involved in both professionally and as a state representative. He was elected last November, and he's serving his first year in the Iowa General Assembly. But Ro's been a strong advocate for kids and family issues, and he's here tonight to talk about an issue that has recently become an important topic in the state, and that's how we're going to provide health care. Last year, Congress at the federal level and President Clinton signed the State Children's Health Insurance Program, which for the first time would, in a number of years, expand our ability to provide health care to young people through the Social Security program. And we've developed an initiative called Healthy Kids in Iowa. Ro, what's going on with Healthy Kids in Iowa?
Well, Healthy Kids in Iowa was an insurance program for children who lived in poverty, but now we have the opportunity in Iowa to greatly expand that program. As part of the Balanced Budget Act, there was $39.6 billion appropriated for the next 10 years to states. Iowa's share of that in the next year will be $33 million. And if we are able to find the matching funds of 25% of that, or slightly over $11 million, we will have nearly $45 million in the next year, actually beginning this past October 1st, to provide health care coverage for children under the age of 19 and who live below 200% of poverty, of the federal poverty level. The federal poverty level is $16,050 for a family of 4, would be 100% of poverty. So we're talking about a family of 4 that earns under $32,100.
I see.
Might be eligible depending on what it is that we offer.
So estimates have it in Iowa about 82,000 approximately kids are affected by this. How accurate is that estimate, and how do we get a sense about those numbers?
Well, it comes from various sources. I think it basically came from Kids Count, which is a national organization that kind of tracks these kinds of issues and social problems and health problems of children in all the states. And we think that's a pretty close figure. It could be up to 100,000, it could be less than that, it could be around 70,000. But we're aiming at 82,000 children in Iowa who aren't insured. We're looking at that gap of the kids who aren't covered by Title 19 and also do not have are not covered by family health insurance. So it's that gap, and those are the 82,000 kids that we believe are living in the families of the working poor.
That's a lot of families and a lot of children. So when we talk about Title 19, we're talking about Medicaid and what would be for the lowest income folks in our state.
Correct.
Okay.
Right.
All right. So there's quite an extensive process in place right now to kind of try and figure out what we ought to cover, what the plan should include. There's been a number of hearings around the state. What have we learned through those public hearings?
Well, it's a very open process at this point, and it's still pretty wide open. We've had a lot of, I've been on a task force with a lot of other people from the state. They're insurance executives, people like school nurses, the PTA, just a variety of a cross-section of Iowans are on this, and 4 of us are legislators in a committee of about 21 people. And we've been meeting to kind of narrow the field down about what it would look like, how we want to go about it, because we need to come up with a recommendation. This task force needs to make a recommendation by December 1st to the governor.
I see.
And then the governor, I don't know what the governor will do with that, but the governor then will put it in some form that he prefers and present it to the legislature. So so then it goes through the legislative meat grinder. So it's pretty wide open, and the task force to date has just come up with a pretty global kind of way of approaching this.
I see. So the recommendations, whatever ultimately gets approved, will be a legislative decision made by the General Assembly.
Correct.
And the governor would have to sign off on that.
So anybody watching might want to contact their state representative or their state senator and let that person know what you would like to see in this insurance package.
So this is a pretty bold program. I mean, at the federal level, $36 billion. And
over 10 years.
Over a 10-year period, and requiring state matching requirements. This seems in the expansion of the Social Security Act. What's the consequence? People have not had care, and we know millions of Americans don't. What's the consequences of not providing health care to young people?
Well, it's interesting that there have been public forums about this throughout the state. In fact, there have been 20 public forums during the month of October. And what we learned from that is that most Iowans, loud and clear, want most of our money put in prevention to prevent later illnesses, to prevent more catastrophic things happening to kids. People, what we also heard loud and clear was that people not only want basic health care, but they want behavioral assessments and behavioral treatments available. In other words, mental health kinds of issues are really strongly addressed. But also dental and vision were also frequently mentioned.
I see. So one of the provisions of the federal act is that states develop comprehensive health care plans.
Exactly. It has to be comprehensive.
Because I know a number of policies, health insurance policies, that maybe a business provides, and it doesn't always include vision.
Correct.
Or in some cases dental or mental health or substance abuse, for example. Certainly mental health, there's a lot of people working to try and have national change. The states regulate insurance, but to have states require, as part of doing business in the state, that insurance company offers so much mental health coverage.
Right. Well, I happen to work in schools, and I've worked in schools as a school social worker for quite a few years. And most any teacher will tell you how difficult it is to obtain a behavioral assessment or behavioral treatment because of lack of insurance, as well as prescription or pharmacy coverage. And that was the other piece. Pharmacy coverage was also frequently mentioned in the public forums.
So there's a lot of decisions to be made. There's been a fairly extensive public input process about what kind of things should be included in a plan, but it's going to be decided in Des Moines. The issue of the state matching money over the last years, we've had, last year in particular, we gave a state tax cut on income tax. It sounds like support for that this next year. Things are tightening up. The economy might be getting a little tighter. I was reading the paper this morning about that. If we have to come up with this $11 million, is there going to be support to do that, do you think, in the General Assembly?
I'm told that there is a surplus. We still continue to have a surplus. The cuts that were enacted won't be actually enacted until the next taxable year, as I understand it. And the governor has recommended this slightly over $11 million to be put in the
Is that right?
Department of Human Service appropriations for the coming year. So that's really where it starts. If he doesn't put that on the table, then it's really an uphill fight. So he's provided that in the budget at this point. So we're pretty optimistic.
Well, that's a very hopeful sign if the governor is thinking that this is something that we should spend money on. I'm glad to hear that.
Well, it's one of those delightful things for me to participate in, because most of the things that we participate in are trying to stop some of the bad things that are happening. And this is some real money. $45 million will provide coverage to a lot of kids.
Well, it's one area where, when we talk about the future of our state, that this is a huge investment and that makes sense to make. We're going to pay in other ways down the road if we don't invest this money. It seems to be a reasonable way to do it. We're visiting with State Representative Foege. He's a Democrat from Mount Vernon, House District 50. We're talking about the Healthy Kids Initiative in Iowa and how we can address unmet health care needs of working poor families and of poor families around the state of Iowa. You're watching Iowa News and Views. Ro, I'm glad you're here. In terms of the management of these dollars, over the last few years we've gone to kind of a managed care environment for how we deal with mental health funding. There's some discussion about family and children's services, looking at hiring an outside managed care company to manage state dollars. Is there any talk at this point about having a managed care company manage this program?
What our committee will be recommending to the governor at this point is that we expand Medicaid to 133% of the level of poverty, and that we cover everybody. Right now, pregnant women and children under 6, up to 133% of poverty are already mandated to be covered. We plan to cover everybody up to the age of 18, and then in a later year expand that to under 19 who live in a family not eligible, otherwise eligible for Title 19. So we'll cover 133%, and then the idea is to buy some kind of a private insurance product that's hopefully operated by a nonprofit corporation for the other families from 133 to 200% of poverty. Why we're hitting on 133% of poverty is that coincides with free and reduced lunch programs, and so that's a real quick kind of screening process. And the other part of this that we've talked about in terms of management and enrolling and recruiting people and finding who needs this product is that we're looking at doing this through schools, somehow doing this through schools. There's a lot of stigma for a lot of people if they think of it as a welfare program. And so we're looking at the possibility of keeping it out of the welfare office. Vermont implemented a program called Dr. Dinosaur, and this is how they did it in a way that was outside of the welfare office. And although we still will need to check to see if they're Title 19 eligible with that system. So there's been a lot of thought about how we enroll people so that we can enroll as many as we possibly can and give as comprehensive coverage to as many kids under 18 and eventually under 19 as we possibly can.
That's terrific. So as this time frame is laid out, when would we anticipate, say, maybe a program being kicked off? Is that a year away, a couple years away? Do you have a sense of that?
Iowa can start drawing down this money from October 1st of '97.
I see.
It was real bang bang kind of a thing because President Clinton signed the Balanced Budget Act in August of this year, and we started working on this in October. And we can draw down starting in October. But it's one of those programs you don't lose the money if you don't spend it. So I would hope that we could have it up and running by the 1st of July and possibly sooner, although that would be pretty optimistic.
Well, that's good. Well, as Ro said, contact your own legislator and let them know how you feel about this, and we'll keep this rolling ahead, and hopefully we'll see something happen this next legislative session to make some things happen. Well, another initiative out there is being referred to as the Iowa Plan that is looking at taking dollars, funding streams of dollars for children's services and family services and rewriting, putting together, bundling those together and having a managed care company come into the state and manage those dollars for the state. The state currently does that and decides what they're going to fund. What's going on with the Iowa Plan?
Well, the Iowa Plan is to merge child welfare services with mental health and substance abuse services, which are already under a managed health care plan. And some of us are pretty leery of that process because we are pretty leery of a process where we pay someone a pretty hefty profit to restrict services to our kids, and that's what's happened in substance abuse and mental health. We have a company that's, as of February of '96, their audit for the previous year was that they had a $9.6 million profit, and that was 22%, a little over 22% of the total revenues were then spent for administration and profits. And we don't think that's right to pay that kind of money to restrict service. We think Iowans can make those decisions.
So previously, we had state employees manage those dollars, and a couple years ago, the state decided to put out for RFP, requests for proposals, the opportunity for private companies to come in, and this company, Merit Behavioral,
that's one of them.
One of the ones.
Well, we put out a contract, but that's who's had the contract.
Right. And so you're saying, the example you used is talking about Merit?
Right.
Okay, I see.
And the problem with that, the other problem for me as someone who's worked with children for a long time, is what I see is we just keep bouncing kids. As I've referred to as, we're playing ping pong with Iowa's kids. Because we're only looking at what's the least cost. Somebody may be in an acute psychiatric facility for 2 days because they're suicidal, and when they don't speak about suicide for 1 day, they're deserted and moved to a less expensive place. Well, we're not providing adequate treatment or the adequate length of time of treatment for those children.
I see. We probably should establish this at the beginning of the show, but Ro has worked professionally in this field, and maybe you could talk a little bit about what you do in your job and what you have done as you speak about this. It's really, being a first-year freshman representative to be on this committee is a very important appointment for you, I'm sure, and that your expertise in this area is obviously acknowledged here.
Well, I've been very pleased to have been able to work on committees that are very much in the area of my life's work. I've worked in family and children's service as a social worker for 37 years in the state of Iowa, and in various kinds of agencies. For the past 20 years I've been with the Grant-Wood Area Education Agency as a school social worker.
I see. So you talk from a lot of experience when we talk about these issues?
Well, I've worked with the courts, and I've worked with the Department of Human Service, and also on some, as a volunteer board member in Lynn County on human services.
So as the Iowa Plan, it sounds like they're putting this on hold to get some more input about how to proceed from what I hear about that.
The legislature was able to slow that process down.
Is that right?
Right, and put it off until February.
So what is the lead agency on the Iowa Plan? Who is promulgating
the Department of Human Services.
So historically they've managed these dollars, and they're looking at that. Well, the other area that as we've talked about in managing care is just the whole mental health dollar in terms of the Medicaid dollars. There's certainly been some concerns about those, how those dollars are managed. If it's any indication of the future, we should pay closer attention to how this money's being spent.
Well, and I would think as a county board of supervisor you'd be pretty interested, because there's a lot of cost shifting going on, I think, with in a lot of these programs, as you're well aware.
You bet. And mental health has been a big area for counties and continues to be. We all have our managed care plans that are being implemented around the state of Iowa, and it's a pretty big part of what we do in county government. About a little more than 40% of our county's budget here in Johnson County is spent on mental health, mental retardation services, which is a fairly significant amount of money.
Our other concern about the managed health care plan, or managed child welfare plan, is that it would kind of be the demise of decategorization, which is kind of a local governance process of providing services. And we felt that that would just undercut that, and so we're very concerned about that. We think local people can make those kinds of decisions.
So decategorization was an attempt by the state to we had a number of streams of funding, and rather than have all these categorical programs, to put those together. And I know I am involved in the DCAT committee here in Johnson County, but there is a great deal of concern, I can tell you, from local folks about the partition that just fell on Roe's head. Excuse me, Roe.
Okay. It's like
I'm on a mic too. Nonetheless, we're very happy that you're here today, and sometimes we have things happen in the studio.
Was it something I said?
No, it might have been something that I said, right, kind of air blowing over there. It's a pleasure to have you as a guest today, and as Rose said earlier, contact your state legislator about these issues. They're interested in hearing about them. The next topic on the show is the People's Podium, and we're going to be hearing from Clara Oleson, and Clara is going to be talking to us about the need to update the state's civil rights law and some ideas on why and how we should do that. Clara.
Thank you, Joe. This is the steady part of the program. We Iowans see ourselves as fair-minded, committed to people getting a fair share.
Get ready, Clara.
Thank you, Joe. This is the steady part of the program. We Iowans see ourselves as fair-minded, committed to giving people a fair shake. And in 1965, we turned our belief system into the reality of the Iowa Civil Rights Statute, now Chapter 216 of the Iowa Code. Our commitment to non-discrimination in employment is in need, however, of serious attention. We have allowed our state civil rights law to become outdated and irrelevant. Last year, over 2,000 persons filed complaints with the Iowa Civil Rights Commission, mostly asserting sex, disability, and race discrimination. With a no-growth budget, the agency is consistently starved by the governor and legislative leaders. It stays afloat by using volunteers and focusing increasingly amount of its resources on educational efforts. It avoids a get tough stance, an enforcement strategy, because the law has lost its teeth. 85% of Iowans' claims of discrimination were in the area of employment. Most of these complainants will have had the courthouse door slammed in their face. But we can do something. What is it? We need to update the Iowa Civil Rights Statute. We need to give persons asserting discrimination claims the right to go to court immediately, if they want to. Now they are required to spend at least some time in the Civil Rights Agency. And the right to a jury trial once they get into the courtroom. And the right to collect punitive damages against both private and public employers when in the judgment of a jury substantial discrimination is proved. Many of these components are applicable through the federal statute, the 1991 Civil Rights Act, which Iowa has not incorporated into our statute as yet. We need to fund the agency so that they can redirect their focus to systemic discrimination threats in industry and to investigate patterns of employment usage which are oppressive, the concentration of women in telemarketing, the ability of the meatpacking industry seemingly to recruit unendingly numbers of undocumented workers. We need to expand the types of discrimination that are prohibited. Someone in Iowa should not be able to be fired by arbitrary and capricious conduct by their employer. Right now, your boss needs no reason to fire you, need not give you a reason to fire you, need not tell you why you are being fired, with some very brief exceptions. It would really be a revolution in Iowa law if we just required that employers act reasonably. You should not be able to be fired because you are gay or lesbian. I think we were all embarrassed by the recent bigotry in Bettendorf in relation to workers at nursing home losing their job simply because of their sexual preference. or because people went through a sex change, or because they tried to unionize their workplace. We are now 42nd in the nation in wages. If we want to give private sector workers the power to create leverage to increase those wages, we need to recognize their civil right to form unions. And people should not be fired because they are young teenagers. More and more young people are working, and yet our law only applies to people 18 and over. In the 90s, these are the kinds of civil rights abuses which we see and which we can stop if we want to. It's time to tell employers in Iowa that they must treat their applicants and employees reasonably and free from discrimination, and that if they do not, their behavior will land them in front of a jury with power to impose significant monetary awards. We should recommit ourselves to prize the liberty to be free from discrimination in the workplace and to maintain a vigilant regulation over employers who would put profit above fair treatment. It is time to get our government to assert that you can go to your job and be treated as an individual with dignity and respect, regardless of how much money your boss has or what politician took it.
Thank you very much, Clara, for that insightful commentary. We appreciate having you on the show. You've been watching Iowa News and Views. My name's Joe Balcom. I'm the host of the program. We appreciate you tuning in. I'd like to thank Foege for being our guest, Democrat from Mount Vernon, state representative, and let him know I hope that we are not going to hear from his lawyer soon about the prop falling on his head. Nonetheless, thanks for tuning in. I'd like to thank our local sponsors around the state for their support of the program and making it possible for this show to be seen in 12 communities around the state. We're going to give you some information on how to contact us in a moment if you've got ideas for shows or guests or commentary. We'd like to hear it. I'd also like to thank our crew, as usual, for doing the good job, and thank those people that have financially contributed. You've been watching Iowa News and Views. My name's Joe Balcom. Remember, this is just a TV program. You're not going to see a lot of what we cover on other stations, so keep tuning in, and remember, what's important is what you're doing in your community to make it a better place. We'll see you next time.